Imagine you're taking the NCLEX and your patient with Guillain-Barré syndrome has an oxygen saturation of 98%. Looks reassuring, right? Not necessarily. That patient could still be moving toward respiratory failure. And that is exactly the kind of detail that NCLEX wants you to recognize. In this review, I'm going to show you why a normal oxygen saturation can give you false reassurance in Guillain-Barré syndrome, what respiratory measurements you should actually be watching, and which findings tell you it is time to act. So remember this question as we go through the review. Can an SpO2 of 98% still be dangerous? Yes, and here's why. When you see Guillain-Barré syndrome on the NCLEX, immediately think about respiratory assessment. Yes, you're going to assess weakness. Yes, you're going to assess neurological changes, but the priority is the airway and the patient's ability to ventilate. That's why I want you to remember this phrase: airway first, oxygen second. A pulse oximeter tells you about oxygen saturation. It does not directly tell you how strong the patient's respiratory muscles are. So for Guillain-Barré syndrome, think respiratory assessment, vital capacity, early recognition and intervention before the patient reaches respiratory failure. And to understand why, we first need to understand what Guillain-Barré actually does. Guillain-Barré syndrome is an autoimmune disorder involving the peripheral nerves. The classic NCLEX pattern is ascending, symmetrical weakness. It commonly begins in the feet, progresses into the legs, then moves toward the trunk, arms, and eventually the muscles involved in breathing. That upward progression is the key. The NCLEX may give you a patient whose leg weakness is getting worse and ask which new finding requires immediate attention. Once that weakness begins affecting the respiratory muscles, the priority changes quickly. And that brings us to the most dangerous complication. Respiratory failure is one of the complications you cannot afford to miss. As weakness progresses upward, the diaphragm and intercostal muscles can become weak. Here's the NCLEX trap. The patient's SpO2 may still look normal. You might see 97%, 98%, even a number that looks completely reassuring, while the patient's respiratory muscle strength is getting worse. So don't make the mistake of looking at the pulse oximeter and thinking, they're fine. In Guillain-Barré syndrome, you need to assess ventilation and respiratory muscle strength, not just oxygen saturation. So what measurements should you actually be watching? Two important measurements are vital capacity and negative inspiratory force. First, vital capacity, or VC. You may also see FVC. This tells you how much air the patient can move after taking a deep breath. A vital capacity below about 20 milliliters per kilogram signals a high risk for respiratory failure. Next is NIF, or negative inspiratory force. This measures inspiratory muscle strength. As the NIF becomes weaker, meaning it becomes less negative, respiratory muscle weakness is worsening. On this slide, a NIF greater than negative 30 centimeters of water is a warning sign. But don't memorize one isolated number and stop there. For NCLEX, pay attention to the trend. If VC is falling or NIF is getting progressively weaker, that's deterioration. And sometimes the patient will show you that deterioration before the monitor does. Watch for a weak or absent cough. Watch for difficulty swallowing. Look for shallow breathing. Pay attention to declining vital capacity, or NIF, and don't ignore fatigue, restlessness, or anxiety. Those may be early signs that the patient is working harder to breathe. The key NCLEX point here is that respiratory failure can develop quickly. You do not want to wait until the oxygen saturation drops or the patient becomes severely distressed. Recognize the decline early and intervene early. So once you recognize those warning signs, what should the nurse actually do? First, assess respiratory status. Look at respiratory rate, work of breathing, vital capacity, and NIF. Second, position the patient to support ventilation, usually Fowler's or high Fowler's. Third, if respiratory function is declining, prepare for airway support. Don't wait for complete respiratory collapse. Fourth, monitor for autonomic instability. Guillain-Barré can also affect autonomic function, so watch for changes in blood pressure and heart rate. And finally, provide emotional support and patient education. These patients may be awake and aware while experiencing progressive weakness, so communication and reassurance still matter. But on the NCLEX, if respiratory status is deteriorating, airway and breathing remain the priority. Now let's see how the NCLEX can test this. Here is the question. A client with Guillain-Barré syndrome has an oxygen saturation of 97% on room air. Which findings should make the nurse prioritize early intervention? Heart rate of 88? No. A temperature of 99.1 degrees Fahrenheit? No. Strong and equal peripheral pulses? Also no. The concerning finding is the vital capacity decreasing from 2.3 liters to 1.2 liters. Why? Because that falling vital capacity tells you the patient's respiratory muscles are becoming weaker. The oxygen saturation may still be 97%, but the patient's ability to ventilate is deteriorating. That is the NCLEX lesson. Do not let a normal oxygen saturation distract you from a worsening respiratory assessment. And if you remember nothing else from this review, remember these 5 points. Number 1, Guillain-Barré is an autoimmune attack involving the peripheral nerves. Number 2, expect ascending symmetrical weakness. Number 3, respiratory failure is the complication you are trying to recognize early. Number 4, monitor vital capacity and NIF, not just oxygen saturation. And number 5, act early. Deterioration can occur quickly. When the NCLEX gives you several findings, ask yourself, which finding tells me this patient's ability to maintain their airway or breathing is beginning to fail? That will often lead you to the priority answer. So here's your final takeaway. Don't be fooled by a normal SpO2 in a patient with Guillain-Barré syndrome. The NCLEX wants you to recognize respiratory muscle weakness before oxygenation begins to fail. Monitor vital capacity, monitor NIF, watch the trend. Recognize the warning signs. And act before respiratory failure occurs. If this helped you understand how the NCLEX tests Guillain-Barré syndrome, subscribe and turn on your notifications because we're going to keep breaking down high-yield NCLEX concepts exactly like this. And remember, a normal oxygen saturation does not always mean your patient is safe.